Hello, everyone, and welcome back to Root Cause CSI. I'm Joan Lu, and in this podcast, we explore health topics through a clinical and educational lens. Because March is Women's History Month, today's episode focuses on another important topic in women's health: endometrial hyperplasia and endometrial cancer. These are two terms that often appear in ultrasound or biopsy reports, and they can understandably cause a lot of anxiety. Today's goal is simply education and awareness, helping listeners understand what these conditions mean and when medical evaluation is important. This episode is to help people better understand the terminology they may hear from their healthcare providers. Understanding the endometrium. So, the endometrium is the inner lining of the uterus. During each menstrual cycle, hormones cause this lining to thicken in preparation for a possible pregnancy. If pregnancy does not occur, the lining sheds during menstruation. Hormones play an important role in this process. Estrogen stimulates growth of the lining. Progesterone helps stabilize and regulate that growth. When this balance becomes disrupted, the lining may become thicker than expected. Endometrial hyperplasia refers to a thickening of the uterine lining caused by an overgrowth of endometrial cells. This usually occurs when the lining is exposed to estrogen without enough progesterone to balance it. Situations where this may occur include irregular ovulation, polycystic ovary syndrome, perimenopause, obesity, certain hormone therapies. Some forms of hyperplasia are benign, while others may show atypical cells, which means the cells appear abnormal under a microscope. When atypia is present, the risk of progression to cancer becomes higher, which is why medical evaluation and monitoring are important. Endometrial cancer occurs when cells in the uterine lining become malignant and begin growing uncontrollably. It is actually the most common gynecologic cancer in the United States. One reason this cancer is often detected early is that it usually produces noticeable symptoms, particularly abnormal uterine bleeding. Symptoms that should always be evaluated by a healthcare provider include bleeding after menopause, unusually heavy menstrual bleeding, bleeding between periods, pelvic pain or pressure. Early evaluation allows healthcare providers to determine the cause of these symptoms. When abnormal bleeding occurs, physicians may recommend evaluations such as pelvic ultrasound to measure endometrial thickness, endometrial biopsy to examine cells from the lining, occasionally hysteroscopy, which allows direct visualization of the uterus. A biopsy is particularly important because it helps determine whether cells are normal, hyperplastic, atypical, or cancerous. There was a time in my own life when I was told that I have endometrial cancer. Hearing those words was frightening, and like many women, I immediately imagined the worst. After follow up imaging a month later, the findings were no longer present. Looking back, it is possible that what I experienced was endometrial hyperplasia rather than cancer, but that experience taught me an important lesson. When it comes to serious health concerns, accurate diagnosis and appropriate medical evaluation are essential. I would also like to share a gentle message to my colleagues in healthcare. When we communicate serious possibilities such as cancer to patients, our words carry tremendous weight. Hearing that word can be incredibly frightening and emotionally overwhelming. Many of my patients have shared experiences of receiving phone calls telling them they have cancer and need further testing. For some people, they receive that call while they are alone at home, without anyone there to process the news with them. I experienced something similar myself. At one point, I was told that I had endometrial cancer based on ultrasound finding, even though a biopsy had not yet been performed. Hearing that diagnosis was extremely distressing. Later on, follow up evaluation showed that the findings were no longer present, and it was likely that what was seen was endometrial hyperplasia rather than cancer. That experience stayed with me. It reminded me how important it is for us as healthcare professionals to communicate carefully and compassionately, especially when discussing serious possibilities. Accurate diagnosis, clear explanation, and thoughtful communication can make a tremendous difference for patients during what may be one of the most vulnerable moments in their lives. If there's one message from today's episode, it is this: any abnormal uterine bleeding should always be evaluated by a qualified healthcare professional. Early evaluation allows providers to identify whether the cause is benign, hormonal, or something more serious. In many cases, early detection allows for very effective treatment. Thank you for joining me for this episode of Root Cause CSI, Clinical Scientific Investigations. During Women's History Month, conversations about women's health and awareness are especially important. If you found this episode helpful, please consider sharing it with someone who may benefit from learning more about this topic. Until next time, this is Joan Lu, and thank you for listening.